Professor Nancy Fontaine, you must be delighted at the CQC report.
I am extremely delighted. Thank you very much, Michael, because this means so much to assure our local community that they will be and do receive really high standards of care, that is safe, that the organisation is an open organisation that gives compassionate care, timely access to cancer treatments and surgery, that critical care has moved from inadequate to good in one inspection, that the end of life care here has moved from inadequate to good just in one inspection. Our mortuary is the first UCAS accredited mortuary in an acute trust, and that our whole estate, the fabric of the building, has already improved in a really short time, that the whole organisation has been behind the improvements. The quality improvements have been led by the staff. This is not a top-down. It was devastating for both the patients and the staff in October 2016, but the grit and determination and the cohesion here is incredible. And at Princess Alexandra, everybody has really grabbed the possibility and the potential of improvement, and continues to do that. The report is great, but for us this is about improving for the future, and quality improvement is embedded at Princess Alexandra. We have a faculty that is bespoke and focused to support even the smallest changes, so that patients and relatives feel that change. So our end-of-life care, we have a bespoke unit dedicated with 8 separate size rooms, ensuite facilities for people to stay, with also dementia patients at the other end of the unit with activities, and we use our voluntary sector to help us. So we've had great feedback. Some of the families have told us it's as good as, if not better than, a hospice. We do not accept poor care at Princess Alexandra, and the nurses, the midwives and the allied health professionals have really driven to maintain our position in the top 10% in the country for infection control. We have only very few, minimal hospital-acquired pressure ulcers. We have fewer complaints and fewer in-hospital falls. We have driven quality at the heart of Harlow, for Harlow.
I hate to sort of predict what comments might be underneath a story on our Facebook page, etc., but things like A&E?
So the emergency department was rated inadequate. It isn't anymore. You know how much duress the department has been in throughout the winter, but we keep patients safe, and our regulators recognise that. And they didn't find anything that, despite the fact we have large numbers of patients coming here, they can see that we have provided signposting out of the organisation, working with our GP partners to provide signposting and primary care facilities, working with our community trust to make sure that we can perhaps tailor a frailty service right at the front door, because not everybody needs to come into hospital. What they might need is an assessment, and then we might be able to put a package around them and then keep them in the community with a different approach. That we support improved heart failure services in the community. So we're working alongside partners to make sure that the emergency department is safe and responsive. What we're now trying to do with our new build, and you can see from the front we've completely changed our process, is actually from a timely access, improve our performance. And there is no doubt that we were in the nadir and poorly performing, but already we've seen the improvements in the numbers. And remember, Michael, that we actually consistently have delivered 3 of the 4 national constitutional standards. We have timely access to cancer care. We're one of the few district generals that do that. For over 2 years, we've delivered all of our diagnostic targets and all of our time to treatment, access to surgery. So for the people of Hertfordshire and Essex, Princess Alexandra is continually and consistently delivering a great service. And it's a safe service, and it's a compassionate service. And I'm really proud to be the Deputy Chief Exec and Chief Nurse of this organisation.